right, well, welcome everyone to our weekly Mindfulness Experience hosted by the AIM Health Institute and the GW Office of Integrative Medicine and Health. AIM is a nonprofit organization geared toward whole health experiences for all people in Washington, D.C. area with a focus on low-income communities and public events and education, such as this. And we're, of course, pleased to partner with the Office of Integrative Medicine and Health at George Washington University, which does leadership training, education, and research related to integrative health and also whole person health to bring the next generation of leaders to the fore and encourage research ongoing into these ways that are health promoting and community sustaining. So please visit our respective websites, Facebook, and things like that. Also, donations help keep our program free for all, so please do kindly consider a donation to AIM supporting this program, healthaim.org. And you can find us on the different social networks. That all being said, it's a pleasure to welcome you today to and we're so pleased to have Dr. Lee Frame and also Nina Paul. Nina Paul is Mindfulness Instructor today, and she's from the Milken School of Public Health at George Washington University. So it's my pleasure to present today's event, and thank you to Janet, Dr. Kogan, and everyone for making it possible.
All right. Thank you, Elizabeth. So, you all know the drill. Questions go in the chat box whenever you want. Today, I have one very short issue, which is masks. And the other one I want to spend a little bit more time, which is kind of a, anticipation for the fall, which I think is we better start now since it's not that long before that's going to happen. So for the masks, I hope by now everybody have certain routine. You have your own sort of favorite ways of doing it. Feel free to share that, by the way, because there are definitely a variety of different ways and sort of all respected. What I do want to bring up a couple of a bit more specific points. So point number one, if you're using the surgical masks, please do not use them forever, okay? So they're not designed to be wear again and again and again, unlimited. Probably, I would say, I mean, they're designed actually to be one-time use, but that's probably impractical. We have to wear them all the time. So if you do use them, definitely no more than a week. And if they appear soiled, they appear solid. If you can't wash them, you can't disinfect them, just throw them away. Now, the cotton masks or clothes masks, the best way I've seen it in the Washington Post article that actually was discussed by one of our own GW faculty, Dr. Knight, basically think of it as it's your underwear. I know it may sound a little gross, but you wouldn't wear your underwear 2 days in a row without washing them, I'm assuming. So think of the same with the mask. There's a lot of, you're sneezing, you're coughing, you're breathing, so the mask gets saturated. There's bacteria that's growing because there's a moisture, so you may want to wash periodically, meaning daily. So that's why it may actually be worth to get a couple of different masks and then you just rotate them. So we kind of doing personally all kind of mishmash. I have some access to surgical masks and N95, so I definitely use some of those. I tend to rotate them, so I have like 3 or 4 surgical masks and I just rotate them. And, and then like a week later or 2, I will throw each mask out and then get a new one. I tend to like more surgical than clothes, but again, it's a personal preference. I like the nose bridge where you can take the adjustable metal inside and adjust it to the nose. I don't know why, especially if I have to wear glasses on top, that's the way it feels. So that's all for masks. There's a question, what about N95? Can you use? Yeah, so, it depends how you use N95. If you just wear it for a few minutes, you probably can use it more than a week. If you wear it for a while, I wouldn't, because it's the same issue as with the surgical mask. They're all designed to be a one-time use. Sure that it's impractical and we're all using them longer, but I don't think that they should be used forever and ever. If you're only using them for a few minutes at a time, like let's say you go in a store for 15, 20 minutes, you probably can use that mask for a while. Just make sure you store it in either a paper bag or a plastic bag that has access to air, but that it doesn't get anything spilled on it or dust lands on it. That's you don't want. It'll ruin the mask. And don't wash any of the surgical or N95. You can't clean them. If they look dirty, that's it. That's garbage can. There's no trying to fix that, okay? Even though we have to buy them. Okay, and then there's another question, and then I'll go to a second topic. So is there any new information about coronavirus survival in elevators? This is related buildings, which high occupancy residential building. I don't think I have any new information about surfaces. I think it's the same that we've had before. It does survive for a while. You know, my suggestion would be simple. I mean, obviously you're wearing masks in an elevator. If you're going through a place where you have to touch surfaces that multiple people touching, you have two choices. You can wear gloves, take them out immediately after you pass that area and discard them, or you can just wash your hands immediately after you get home. You know, sometimes what I would do in an elevator is I would take the phone. Oh, you can't see that, can you? Hold on a second. So I would take the phone. I know it's not necessarily a good idea. And I would use the corner of the phone to press the button. And then, you know, with some, maybe not every day, but I would clean the case, you know, a couple times a week. I take a alcohol spray or and I have a case that's it's an industrial case, so it's supposed to withstand both impact. They claim that you can drive over it. I haven't tried it yet. And it's also waterproof, so I can spray liquid right on it, and it's supposed to be okay. Okay. Okay, so the second thing, and I'll come back to questions. So the second bigger issue, in my opinion, so, you know, we're kind of in the area in our zone in DC, and I know there's some people not from DC, that we're reached a certain stability level. The virus is growing slowly. There are some uptick in hospital admissions and cases, but it's sort of like we're not seeing an explosion. So as I said it probably a couple of weeks ago, we're starting to get sort of used to the situation to some degree, right? The panic has moved to this kind of, I would say, just a steady state of a continuous stressors and pressure. You haven't noticed probably that we didn't discuss supplements and like specific nutritional support of the immune system. We've done more of it in the beginning, and we're kind of tapering it a little bit. So what I want to do is just to give you kind of the way I feel what's going to happen. If you feel like you're getting filled up, like it's just too much of doing all the things, and you know you have your regime, but occasionally you fall off, like you forget your supplements, or just acknowledge that. That's okay. I think right now for the next couple of weeks, the period is going to be that, you know, we're just going to continue where we are. Come sometime fall, probably your typical October, November, whenever flu starts coming, there is an anticipation that this may be going to be one of the worst seasons we've ever seen, because combination of flu and the COVID is not something that anybody wants to see. Unfortunately, it's coming, and I think that starting sometime in the mid-September, I would say get back on a wagon of being very aggressive with all your things that you do, whether it's, you know, intermittent fasting, micronutrient-rich diet that Dr. Frame talked to us several times, all the supplements we discussed, you know, more paying attention to sleep, keeping circadian rhythm good, making sure you go outside into the daylight early in the morning, you know, everything we've discussed. You know, it's hard to keep everything right, and I think for everybody, it's just one of those things that it's just not possible to be 100% good at all the times. But I think there are periods where it's more important. So right now, it's probably a period where it's slightly less important. And then in a few weeks, it's probably going to be way more important. So I think we'll have to cycle back. And I think what we'll do is in September, we'll go back and recycle a couple of topics. I think we'll recycle the importance of some basic nutrient supplementation, things that we talked about, zinc, vitamin C. We may cover additional herbs, additional fungi, mushrooms. So we'll see how that goes. I'm planning on doing that probably myself. Maybe Dr. Frame will help me, and then we'll see if we bring somebody else to do that as well. So with that, I want to address the questions, and then we can give floor to Nina. So there's a question about, there's some private questions, I may answer those, but does ultraviolet light disinfects? No, so don't do that. We don't have the equipment that can do that. It's not, the commercial grade equipments in the hospital, they're claiming that they're doing this. I think putting masks on the sun or trying to use some equipment that you get on Amazon, I wouldn't do that. We don't know whether that works. We don't know if it works at all. We don't know if it works partial. Yes, masks are a few dollars, but my suggestion, if the cost is an issue, get clothes or cotton masks and just reuse them. Just wash them in just the warm water and soap. You can wash them with your hands if you don't have it filled up, the laundry. But that's, or just use the new surgical mask. That's what I would do. I don't think there is any data to support any kind of devices for now. We are not talking about the hospitals have these devices called autoclaves, which are very high pressure, high temperature sterilization equipment. Those are expensive, and they're not light. They're temperature and pressure. So that's a good question.
Misha, what about the flu shot? Should they be getting the flu shot?
Yeah, it's always a great question, and I'm the one that always give a very weird answer about flu shot, because as a geriatrician, I say everybody over 65 should get it. But I actually think that the flu shots have been horribly ineffective. They've never reached 50% for past multiple years. And by the end of the season, they were about 10-15% efficacious. So, with that, I never was pushing anybody less than 65 or the people who have multiple medical conditions, and I was just worried about them specifically. I never really pushed that. It's very different for healthcare workers. But I think in this season, I may change my mind and say everybody, just because, the problem is you get one acute illness, and if somehow you have something brewing in the background, well, then you have a double whammy. That's what's the fear. The fear is that flu is a lot more contagious. And, we usually in any given season, most people just don't even know they had it, right? I mean, they just pass through it and they have a fever half a day and they think it's a cold or whatnot and whatever. And so I think this year probably we should be getting a flu shot. The issue is we don't really know the efficacy of the flu shot. And moreover, we don't know if at the same time they're going to roll out, hopefully, right, the COVID vaccine, which Moderna vaccine, we talked about this last week or the week before this, the trial is already on the way. So they may be able to finish trial pretty quickly in a couple of months. So if that happens and say October comes, mid-October, November, and we have a COVID vaccine and a flu shot at the same time, I think the combination of two is completely unknown what's going to happen. So that's just cautionary message. I don't think it's going to change the way I'm going to approach it. I think maybe the only people I wouldn't vaccinate would be kids if they're healthy. If they're unhealthy, that's different. But everybody else, even myself, I'm the one not taking the flu shot, even unless I work a lot in the hospital than I do. But, I think this is the year when I may change my mind. Good question. Okay, question next. Let's see. Overdue for getting my teeth cleaned. Should I risk doing this? Yes, now is a good time. Actually, it may even be better than a couple months from now. Remember, if the wave hits because of the flu and there's just simply a sinking immune system for some of us, the spread may increase. So I'd say whatever you kept putting away for the, the other day, do it now. I don't expect somehow magically things get resolved. I don't think you should be waiting for vaccines to get the routine things like this. You should just do it. You know, and the problem with the teeth cleaning, it's a bit individual. If you're always had great teeth and your cleaning was just but if you have a little bit of a periodontal disease and they really tell you you've got to come in twice a year, don't skip that, because that is you know, there is a reason why they say that.
What about sunlight for disinfecting masks and or other things?
That's what I was saying. I don't think there's any clear evidence. You know, Mr. Trump told us that it's supposed to work. He's not a scientific authority, last time I checked. So there is not a single study saying that disinfecting a mask, leaving them on the sun is going to do anything. So I wouldn't recommend that highly. It doesn't seem to me that it's going to work because sun can only disinfect the surface. What about the internal layers where you can still have a virus sitting? So I can't imagine that technically it's going to be quite effective. It's attractive because it's simple, just leave them out. But you know, I don't think we can say that. Hopefully somebody was doing the trial on that actually. So my question 2, how are we doing on time? Are we okay? Okay, I can take a couple more minutes, I think. I've been saturating my surgical mask with alcohol, aloe spray, then yeah, so the problem when you do that, if you saturate the surgical mask with alcohol, it destroys the connecting fibers. So that's the whole point. There's really no way to do that. I mean, you could probably do that to the cotton because it's some material that has more, but I wouldn't do that to cotton either because it's just easy to wash it with soap and warm water. So yeah, that's definitely not going to work. And it's probably, again, as I said, it's probably going to decrease the efficacy of the mask. So thanks, Suzanne, for volunteering the information. All right, screen keeps covering dark speaker policeman. Oh, okay, that's not for me. Oysters Rockefeller, awesome. I love oysters, very high in zinc. So if you hate taking pills and you know, nothing better than a glass of white wine with a dozen of oysters. That's my opinion. But yes, oysters are great. I think, Lee, I don't know if you remember the number, but they're very high in zinc. Something in the magnitude of 100 milligrams for a dozen.
Oh no, it's actually even more than that. It's more like 400 for a dozen.
Wow. Okay. Well, there you have it.
Depending on the size, right? Because some of them are small, some of them are big, but.
Right. And yeah, so then you don't have to do that every day. Once a week probably is a pretty good boost. Washington Post article, rare common electric cooker cleaner cleans.
Misha, you went on to mute by accident.
Oh, sorry. I didn't see that in a Washington Post article about cooker cleaners for N95. I read the whole article. I thought that they were quite clear and not to do that. And from my understanding is the N95s are even more problematic to do any kind of cleaning because they contain plastic that surrounds certain areas and the foam, and that's gonna definitely be very heat sensitive. So I would not heat that. Or use any disinfectant on those. You know, and then N95, I mean, the reason to wear them is only when you're highly suspicious of going into an area where you know somebody is sick. If otherwise, I think it's probably unnecessary because they're a little bit harder to wear and they're a lot more expensive. And yes, they're much more protecting you, not necessarily people around you. Actually, they're not. They're protecting you mostly, and whether you're wearing any mask, I think that's sufficient for protecting others. Okay. Right, so if you're a healthcare worker, you're typically mandated to get a flu shot, so that's out of the question. They're, I'm sure, going to offer that this year as well. You know, some people can get around the mandate in certain circumstances, but in reality, I think this is the year where this is going to be suggested for everybody. Sunlight help disinfect. We talked about that. I think I covered everything. I think it's good timing. So, Nina, do you want to take over and I'll go mute myself? And thanks so much for doing it again. Great to have you back.
Absolutely. Well, happy Friday, everyone. And it's great to be with you again to practice mindfulness together for stress relief, a sense of presence and calm and well-being. And I just want to remind everyone, though, that sometimes when we're practicing meditation, you don't necessarily feel calm and Zen-like, and you may feel uncomfortable or struggling with something emotionally. So I just want to remind everyone that that's quite normal as well. And what's most important is that you bring attitudes of kindness, acceptance, curiosity, and openness to whatever you're feeling or thinking as we go through the meditation. There's no exact right way to do meditation. Just be open and bring a lot of loving kindness towards yourself to whatever you're experiencing. So today we'll practice 3 meditations. In the first one, in addition to anchoring our attention on our breath, we'll be inquiring into the nature of our thoughts. A crucial skill that we can develop with mindfulness is to learn to get some separation and perspective from stressful thoughts. Because when we're triggered by stress, our thoughts tend to take us into a downward spiral of negativity, and we get completely enmeshed with them. And furthermore, our mind tends to tell stories when we're under stress. We're overthinking our problems, thinking about the worst case scenarios, jumping to conclusions, and just thinking about our problems in a very pessimistic way, which is typically inaccurate. And so how do we get perspective with our thoughts when we're under stress? And that's where mindfulness comes in. We can unhook from our thoughts, not by suppressing or avoiding them, but allowing them to be, allowing them to come and go, not getting caught up in their content. It's as the ancient philosopher Aristotle said, the mark of an intelligent mind is the ability to entertain a thought without believing it. So we'll work with thoughts in the first meditation. In the second meditation, we'll move into a body scan as a way to connect us more deeply with our bodies, to feel more embodied, to give our mind a break from thinking all of the time, and perhaps to even release tension in our body, tension that we didn't even know we were carrying. And we'll close with gratitude meditation. So gratitude meditation brings warmth and positivity to our minds and our bodies, reminds us to express gratitude and take in all of the good things that are already in our lives. So let's get started. So go ahead and get into a mindfulness posture where you're sitting in an upright and relaxed position. You can also lie down if you like, that's perfectly fine too. And you could put your hands on your laps, feel your feet on the floor, close your eyes, or have a soft gaze downward. What's most important is you feel comfortable and relaxed, and you can change your posture at any time that you need to. So we'll start the first meditation by taking a few deep, calming breaths. Let's take a full, deep breath in through the nose. Slight pause and then a long, slow exhalation out through the mouth. Feeling the tension leave your body on the out breath. Let's take another full deep breath in. Long, slow, deep breath out. Let it all go. Releasing and relaxing on the out breath. Let's take another full deep breath in. Long, slow, deep breath out. Releasing, relaxing, letting go on the out breath. And reminding you that the longer and slower you go on the out breath really helps to relax the nervous system, the body, the mind. Let's take another full deep inhalation. Long, slow exhalation. Let it all go. Feeling tension flow out of your body. And then returning to the natural rhythm of your own breathing. When you're ready, taking a moment now to notice what it feels like to be sitting. You can notice your feet making contact with the floor, your legs against the chair or the cushion. Notice your shoulders, releasing tension in your shoulders. And just noticing the body as a whole, sitting here breathing for a moment here. And now bring your attention to your thoughts. So getting a sense of the nature of the mind. Is the mind busy and full of racing thoughts? Does it feel calm and still or somewhere in between? What is the thought traffic in the mind like right now? Just noticing that. And now getting a sense of observing your thoughts coming and going. Silently ask yourself, what am I thinking right now? See if you can notice thoughts arising. There may be thoughts about the past or the future. Stepping back, watching them come and go. As if you're standing on the banks of a river, watching the leaves float by. The leaves representing your thoughts. So you're watching your thoughts coming and going, not getting caught up in their content. They're just words and images passing through the mind. And if you like, you can silently label your thoughts simply as thinking, letting them come and go, letting them be. Simply observing thoughts. As if the mind were like the vast sky, and our thoughts are like clouds arising and passing away. So the mind is like the sky. The sky is simply awareness. holding whatever comes and goes in awareness, thoughts, clouds. So just like the sky to the mind. Awareness of our thoughts, observing them, letting them be, letting them go. If you find yourself caught up in a particular thought and its story, you can unhook yourself, step back, just observe the thought, thinking. Let it be, let it go. We cannot control our thoughts or suppress them, but we can relate to them differently with spaciousness, just observing them, letting them be, letting them go. Watching thoughts moment to moment as you're breathing. And now letting go of watching thoughts. Bring your awareness simply to your breath. So focus your attention on your breath at your belly, your chest. You can put your hands in one of these spots as a way to help you anchor attention on the breath. And then just feel the sensation of the breath coming in, the breath going out, the rising and falling of the belly or the chest, moment to moment, breath by breath. Just this breath coming in, just this breath going out, one breath at a time. The nature of the mind is to wander. So if you notice your mind going off into thoughts or distractions, you can simply label that as thinking, or wandering. Let it go and bring your attention back to the breath. Each time you notice it wanders off. That's the essence of the practice. Now let's move into the body scan. So in the body scan, the work is to simply notice sensations in the body. You might notice sensations of tingling, heaviness or lightness, warmth or coolness, pressure or pulsing. Just being aware of the sensations with acceptance and curiosity. There may be no sensations at all, and that's fine too. So I invite you to bring your awareness to the feet, noticing the soles of the feet, the toes. You can wiggle your toes, the top of the feet, and up into the ankle joints. Bring a sense of curiosity to the sensations, openness, acceptance, letting be, and then shift awareness up from the feet and the ankles to the legs. And now shifting attention up to the hips, the hip region of the body, opening up to sensations here. From there, shifting attention into the torso, being aware of the back, the lower back, the upper back. Sometimes we tend to hold our tension in the back. See if you can get a sense of breathing into the back, letting tension go on the exhalation, softening, relaxing, releasing in the back. Breathing with it. And now bringing attention from the back to the belly. You can put your hands on your belly if you like, softening the belly, releasing and relaxing the belly. You might notice your breath coming in and out at the belly. Just letting be. Letting go here. And then bring awareness up from the belly to the shoulders. So we can take a deep breath in and bring the shoulders all the way up to the ears. Deep breath out, bring the shoulders back and down. And the out breath, expanding the chest, opening it up, releasing the shoulders. Softening in the shoulders as you're breathing. And now become aware of your arms and hands, so shifting attention to the upper arms, the elbows, the forearms, wrists, hands, and fingertips. Sensing into the entirety of the arms and the hands. Opening up to all of the sensations here as you're breathing. Allowing and just letting be sensations here. And now shift attention up from the hands and the arms to the face. So we'll start with the jaw, softening and releasing in the jaw. Letting the tongue go loose in the mouth, relaxing the mouth. And then bringing attention up to the cheeks, softening the cheeks. Releasing and relaxing in the cheeks. And then noticing the spaciousness behind the eyes. Softening the eyes, releasing tension here as best you can. Breathing with it. And then easing your attention up into the forehead. We tend to hold our tension in the forehead, softening the forehead. See if you can let go and relax, release in the forehead as you're breathing. Bringing attention now to the entirety of the face. Noticing sensations in the face, sensations on the skin. See if you can get a sense of softening and releasing tension in the entirety of the face. Letting be and just letting it go. As you're breathing. We'll close the body scan by bringing attention to our entire body, getting a sense of the mind and body connected. So start by sweeping attention from the top of the head all the way down the body, scanning the body to the bottom of the feet. And then when you're ready, sweeping your attention from the bottom of the feet all the way up the body, scanning the body up to the top of the head. And now getting a sense of your body, your whole body in its entirety. A sense of the mind and body connected. Whole body sitting here breathing or lying down breathing moment to moment, breath by breath. Enjoying any warm feelings, a sense of calm and ease that might be arising now. Opening up to that. Taking that in, bringing kindness and nurturing anything uncomfortable arising. And now we'll move to the last meditation, where we will be inviting in and cultivating gratitude. I like to put my hands on the heart center of my body when I'm focusing on gratitude. Feeling the warmth of the hands on the heart can bring an ease to the mind and the body, bring more feelings of warmth and positivity to our minds and our body. So bring to mind now someone in your life that you're feeling very grateful for. Calling this person to your mind's eye as vividly as you can. Or imagine a thing or an experience that's happening in your life right now that you're just feeling really good about, feeling really grateful for. And it can be a group of people, a group of good things. Just imagining it in your mind's eye as vividly as you can. Notice any warm feelings arise as you're thinking about this person or people or things. Noticing all the details of it. And then send out your gratitude. Could silently say to this person, I'm very grateful for you. Thank you. Thank you so much. Very grateful for these good things, these experiences. So sending out that gratitude in whatever way you're drawn. And then noticing what your body feels like as you're sending out gratitude. Increasingly inclining your mind in its direction. Expanding into gratitude. In the midst of difficulties, there's always something that we can be grateful for. We open up to gratitude and express it. internally and externally to others. It's no wonder that the science shows that gratitude has so many health benefits for our bodies, our minds. And as you're sending out gratitude, you can open up the lens of your awareness to include your body, your breath, other things coming into your awareness. Resting in gratitude moment to moment, breath by breath. We'll focus in this way for a few minutes, just opening up to gratitude. Taking in the good feelings that may be arising as you're expressing it. Let's take a full deep breath in and out now, bringing the meditation to a close. Opening your eyes when you're ready. And as you're transitioning back to the room, you can stretch. Stretch out your neck. Shake out your body. Whatever you need to do to transition back into the room. Welcome back. Wonderful job.
Thank you, Nina.
Thank you.
Nina.
Always a pleasure to have you with us.
Thank you. Same here.
Thank you so much.
Right. So let's see if there are any last minute questions, anything. And also, if there's any requests for upcoming weeks, please don't hesitate, again, to put them into the chat. Well, I guess with that, thank you, everybody. Thank you, Nina. And we'll see. Well, I won't be here next Friday. I'm kayaking for a couple of days, so I need to take time off. But we'll see you soon. Okay. Bye.
Take care, everyone.
Bye, everyone. Oh,
Thank
we're
you.
doing acupressure next week.
Great.
Thanks a bunch.
Very
Safe
exciting.
travels, Misha.
Thank you.
Thank you. Gracias.
Bye. And welcome to my dear friend Peter, who's Peter Klingber, who came on to join us. I don't know, Peter, you want to say a word?
Hi, yeah, I'm in Tucson, Arizona.
Yeah.
Misha and I have been good friends for probably over 15 years now.
Welcome, Peter.
And Peter's doing integrative psychiatry there. And yeah, you're still there? You're still in?
Yeah, yeah,
Yeah, awesome.
yeah. So I'm a child and adolescent psychiatrist mostly, and I do work with kids who have post-infectious sort of flares of psychiatric issues in particular.
Well, great. Great. Maybe you can share your wisdom with us one of these Fridays.
Yeah, that would be nice.
That'd be awesome. All right. Well, Janet and I will reach out to you.
Cool.
Okay. Great. Great seeing you, man.
Mhm.
Bye, everybody.
Take care, everybody.
Bye, everybody. Thank you.
Bye.
Thank you, Janet.
Bye.
You're welcome.
Okay.